Welcome back to my channel. Today, we will be discussing a very important topic that affects millions of people worldwide. Thyroid disease. Before moving ahead, guys, 90% of you have not subscribed. Request you to please like and subscribe for more important and informative videos like this. Did you know that 15 in every 1,000 women suffer from thyroid and 1 in 1,000 men has thyroid? While diet monitoring is vital for thyroid patients, there are many other essential factors that you should pay attention to. But don't worry, in this video, I'm going to share with you everything you need to know about identifying the symptoms of thyroid disease and taking precautions to keep this condition at bay. First of all, let's talk about what thyroid actually is. It's a small butterfly-shaped gland located in your neck that produces hormones that regulate your metabolism. When this gland produces too much or too little of these hormones, it creates issues in your body. Firstly, it is crucial to know how to identify thyroid problems. There are two broad types of thyroid disease: hyperthyroidism and hypothyroidism. Hyperthyroidism is characterized by sudden weight loss, an increased appetite, a rapid heart rate, and trembling of the hands. On the other hand, hypothyroidism can cause weight gain, fatigue, hair loss, and muscle weakness. Certain factors can increase your risk of developing thyroid disease, including age, genetics, gender, and autoimmune disorders. Women over 60 and individuals with a family history of thyroid issues are more likely to develop this condition. Did you know that having diabetes actually increases your risk of developing thyroid disease? And vice versa? It's true. Whether you have type 1 diabetes, type 2 diabetes, insulin resistance, or metabolic syndrome, your chances of developing thyroid disease skyrocket. And guess what? If you're overweight or obese, that association becomes even stronger. One of the thyroid's mischievous acts is hyperthyroidism. When your thyroid produces too much thyroid hormone, your metabolism goes into overdrive. And what does that mean for people with diabetes? Well, it can affect your blood glucose control. Your medications might not stay in your body long enough to do their job, leading to elevated blood sugar levels. On the flip side, we have hypothyroidism, where the thyroid is a bit sluggish. When your thyroid doesn't produce enough thyroid hormone, your body slows down, and you start experiencing symptoms like fatigue, feeling cold, and even depression. And guess what? These symptoms can often mimic those of diabetes. So, what can you do to navigate these intertwining conditions? For diabetes management, focus on a nutritious diet, regular exercise, and maintaining a healthy weight. Don't forget those blood glucose checks and medication adherence either. And for thyroid disease, the treatment options will depend on whether your thyroid is overactive or underactive. But fear not, there are effective solutions available. If you suspect you have thyroid disease, there are a few tests your doctor may perform to diagnose it. One common test is a blood test to evaluate your thyroid hormones and thyroid-stimulating hormone levels. Another is an ultrasound to examine your thyroid for any nodules or abnormalities. So, what are the precautions that thyroid patients should take? Let's take a look. It is vital to check thyroid levels regularly, whether you do it at home or via a lab test. It is up to you. A doctor may completely depend upon the blood test for diagnosis and overlook thyroid dysfunction, leaving many people undiagnosed. Therefore, have a frank discussion with your doctor and seek clarity. Thyroid patients must always drink distilled water, as it helps the thyroid to function correctly. Distilled water also ensures cleaning the liver and kidneys of toxins. Foods with vitamin B such as crab, shellfish, Brazil nuts, and kidney beans can be beneficial for thyroid patients. These foods contain selenium, an enzyme that converts T4 to T3. Tyrosine-based foods include almonds, sesame seeds, oats, etc. Antioxidants-rich food includes all fresh vegetables and fruits. These kinds of food can reduce inflammation and help enhance health. Thyroid patients must stop smoking or drinking alcohol immediately. Alcohol is a depressant and suppresses the thyroid gland functions. Tobacco or smoking blocks the iodide ratio and synthesis of hormones. Sugar and caffeine can stress the thyroid gland and cause it to work harder than usual. Limiting sugar and caffeine in the diet can help, as well as the improvement in thyroid function. Thyroid diseases require specific medications, and self-medication can be incredibly harmful. Never self-diagnose and always listen to your doctor's advice. And that's all for today's video. I hope you found this information helpful in understanding about thyroid disease and its link with diabetes and what precautions you can take to manage it. By understanding the symptoms, risk factors, and management strategies, you can take charge of your health and live your best life. If you have any further questions or concerns, please speak to your healthcare provider. Guys, don't forget to like, comment and subscribe, as every like and subscription boosts my confidence to keep bringing you with videos that inform you and help you.